Tonight, some important news for parents on this very topic. The American Academy of Pediatrics now says all kids, not just those who play sports, should be screened for potential heart problems at least every 3 years. Sudden cardiac arrest is rare in young people, but it can happen, and that's what's important to remember. According to the CDC, 2,000 people under the age of 25 die from sudden cardiac arrest each year. And joining us tonight is Dr. Parikh Sharma, a cardiologist at Rush University Medical Center. Doctor, as always, we appreciate your time on this very, very important topic.
Thank you, Marnie. Thanks for having me.
First of all, is this not something that's already happening, screening our youth for potential heart problems?
Yeah, that's very important. I think a lot of press has been generated as a result of Christian Eriksen's story. And, I think most parents tend to take their children for pre-participation or sports or athletic screening, as we call it, pre-participation examinations. And that's the time at which all these questions are generally asked by the pediatrician or the pediatric cardiologist as part of the screening protocol to ensure that kids are not at any higher risk. And I think this updated policy document by the American Academy of Pediatrics, that is really an update from 2012, highlights that this can be incorporated on your yearly visits with your pediatrician without adding too much more onus to the healthcare system by just simple screening questions.
I'm sorry to interrupt you. Does this mean that this will now be standard when we take our kids to the pediatrician, or do we have to ask for them to be screened?
Well, the policy document essentially provides a guideline to your pediatrician saying these are the routine questions you should be asking the child and the child's family every 3 years or so, roughly middle school, junior high, and high school, in addition to the times where they come in for that essential pre-participation or athletic screening. And that's really an assistance to all of the pediatricians. And I hope that all pediatricians will follow this recommendation.
So what are the hopes that they may find of the many people that they screen? Who might they catch? Is there a guess on a percentage of people that they might be able to catch that something's wrong with their heart?
Yeah, I think like you highlighted, about 2,000 individuals under the age of 25 years old are lost as a result of sudden cardiac death annually in the United States. About 60% of these can be attributed to structural problems with the heart. That basically means that if you expand the net of screening all your pediatric children population, you would potentially identify kids that are more prone to some of these sudden cardiac death type events, thereby necessitating appropriate further advanced care by a pediatric cardiologist or a cardiac electrophysiologist, thereby helping these kids.
This is really big news tonight. I appreciate your time in getting the word out. So again, the guidance from the American Academy of Pediatrics is incorporating cardiac risk screening by pediatricians for all kids, whether they play in sports or not, at least every 3 years. Dr. Parikh Sharma, thank you for your time once again.
Thank you very much. Have a good night, Marnie.